Theo Vaughn is everything that people say Joe Rogan is in a podcaster. Really good at conversations. He's a lot smarter than Joe Rogan. He's a lot more funny naturally than Joe Rogan is. Everything about Theo Vaughn is very lovable. He's kind of all over the place. He has a really real upbringing. I think the way he approaches conversations is awesome. And it works great with Bernie Sanders here. Does Bernie make Theo a socialist? No, but this really shows where the issues can connect. And I know Bernie had a podcast with Joe Rogan a few years ago, but when you hear Theo interact with Bernie, there is a real understanding from Theo's perspective. There's a lot of patience from Bernie. They're really going back and forth at a deeper level than Joe Rogan was. And obviously Joe Rogan changes his opinions on every single video. Theo does that as well, but he usually doesn't get super serious. But on a humanity perspective, I'm really happy with how this went.
If you're asking me, are we a democracy? In one sense, we are. All right, you can run for office. You can raise your issues. On the other hand, in terms of who has the real power, money people do. And I use the term oligarchy. An oligarchy is a society where small numbers of very wealthy people control the economic and political life of the country. I think.
Pay attention to how Bernie described that, by the way. So Bernie does not assume that everyone knows what he's talking about. Right now, everyone's in their bubbles. So terms like oligarchy and whatever you might use, fascism, socialism, whatever, everyone has their own descriptors for these things. Bernie isn't going to assume anything. He's not going to treat you like you're dumb, but Bernie's going to say, hey, I use the word oligarchy. This is what it means to me, which is a really good tool to use in a conversation, especially with someone who's not super into politics.
Small numbers of very wealthy people control the economic and political life of the country. I think we are moving rapidly in that direction.
Yeah, I feel like to me, it feels like a almost privatized communism in a way.
Right. That's a very good point. It's an interesting way of looking at it.
Yeah, and I don't know exactly sometimes everything of what communism is and what socialism is, but sometimes that's how it feels.
Well, let me give you an example. Can I pick up on your point?
Yeah, for sure.
Okay. I believe we are the only nation on earth, major nation, wealthy nation, that does not guarantee healthcare to all people.
Please learn from Bernie, because a lot of y'all come off very weird when you talk about these concepts. Learn from Bernie's rhetorical strategies before he's gone, please.
Okay. Get in your car, go 50 miles where you are sitting right now in Burlington, Vermont.
Take some notes.
You have a terrible automobile accident. You're in the hospital for a month in Canada. You know what the bill is when you come out? Zero.
Nothing.
Okay. Do you know how much the Canadians spend per person on healthcare compared to us? 1/2 as much. They spend half as much. You don't take out your wallet. If you get sick, you go to the doctor that you want, okay? I believe in that type of system. They guarantee healthcare to all of their people. Mm-hmm. It's publicly funded the way we fund police departments, fire departments, and libraries, okay? You got to pay taxes for it. But at the end of the day, it is less expensive for your healthcare. You follow what I'm saying?
Yeah.
Okay.
Yeah, because you're a proponent for healthcare for all, right?
I absolutely.
And yes, and you always have been. And but how the system seems so rigged, because you have like one of the number one causes of bankruptcy in America is medical debt, right?
Yes.
Unbelievable. Like people can't, people, they go in, they don't even know the cost. They sign an agreement that they're going to be billed later, right? It's like, and then they get the bill and it's astronomical, and they spend the rest of their life literally a slave to the healthcare system or to the medical billing system or the dealing with their insurance, and not to mention they're sick. So the added stress of that, it just feels like like something so much better could be done.
Theo, that is so pathetic and so sick and so cruel. I mean, we did a hearing on this, and roughly speaking, and I know the viewers will think this is like hard to believe. Half of the people who are dealing with cancer, and cancer is a terrible disease, right? Your point.
100%.
You're struggling.
Watch how Bernie's connecting it right now. I think usually when a progressive person would hear Theo or like anyone say what Theo said, they would instantly go into, well, support this guy because Medicare for all will take care of that and blah, blah, blah. Bernie isn't going to do that. He's going to go to a direct personal experience and connect it to the real life, what real life Americans are facing, instead of going ideological right away.
We're dealing with cancer. Now, cancer is a terrible disease, right? Your point.
100%.
You're struggling for your life, right?
Bad, yeah,
maybe
bad.
you make it, maybe you don't. You got radiation, chemotherapy, bad stuff, right? Half the people who get cancer treatment either end up in bankruptcy or utilizing all of the financial resources of the family. They're depleted. They're broke. So imagine that. You go into the hospital. Doctor says, Theo, sorry, you got cancer, terrible. You're worried to death, right? Your friends, your family are worried. And then on top of that, what are you worried about? Oh, my God. What, I'm going to have to sell my house? Or I have to go bankrupt in order to pay medical bills? That is insane.
Yeah.
And it adds, if you're trying to deal with cancer, then you got to worry about financial stress. Think it's going to make your condition any better?
No, the worst. You spend half your day, you can't even, in the insurance companies, it's all a rigmarole. It's constant stress. But how is it set up like that? Like, what is the gimmick between insurers and the hospital? That's the thing I don't know. What's going on?
All right, take it a step. Let's take a step further.
Okay.
Let me talk about the Canadian system. All right.
Okay.
Simple system. You pay taxes, and progressive. The more you make, the more you pay. But everyone pays taxes. All right. End result is you walk into the hospital, you sign your name, you got all the treatment you need, and it's good quality healthcare. You don't have to argue with insurance companies. You get the care that the doctors think you need. End of discussion. And in my view, that's the way it should be. It's not just that the insurance companies make huge profits. They do. Not just they pay their CEOs exorbitant salaries, which they do. Everybody's got to fill out 1,000 different forms, right? Goes crazy. Filling out forms to see what you're entitled to, what you're not entitled to, deductibles, right?
Yeah, the bureaucracy. It's ridiculous.
Right.
Is that called bureaucracy? Yeah.
Yeah, that's exactly what it is. All right, so look, you may have health insurance, but I just talked to a person the other day. We did a meeting. You know what their deductible was? $13,000. What does that mean? It means that the first $13,000 of illness they got to pay out of their own pocket. How many people can make $13,000? So if you get hit by a truck and you're up $1 million bill, yeah, the insurance companies will kick in, presumably. All right, so the whole idea that healthcare in America, unlike every other major country, all right, go to Europe, go to Canada, go to many Latin American countries. It is a bloody right, not a privilege, and that's what I think it should be. So we have
another point too is saying, do you believe that America can do this? Because if these countries can, why can't America if we're the richest country in the world? Talking about the resources, bringing it back to personal experiences. Bernie talking about how much it costs for someone to get healthcare. Also going into the societal factor of even if you are healthy, you don't want to have a society where your neighbors are stressed out all the time, where your neighbors are having terrible lives, where your community is full of people struggling to pay off medical debt instead of being able to focus on their kids, their family, and being a good neighbor, which is a big part of what's happening. That's a big part of Tim Walz's messaging on the campaign trail right now. A lot of it's being a good neighbor and having a system to support everyone that you live around.
System that works very well for the insurance companies and the drug companies. In some cases, you're going to pay 10 times more for medication in America than they do in other countries.
And how about some pride in helping humans in general? We spend so much time in the media and on these campaigns, especially the Trump campaign, of course, talking about how much we want bad things to happen to people. We need to eradicate stuff. We need a war to happen. We're going to have a civil war, world war. We're going to have a Great Depression, whatever, all this negativity. What happened to just wanting to see good things happen to humans? Why is there so much anger, violence, and a lust for blood instead of progress,
That's a whole other story we're trying to deal with right now. But it's a corrupt system benefiting the people who own it, not the ordinary American. You go out on the street, say to people, do you think healthcare is a human right? All people in America should have it? Yeah, we do. That's what I'm fighting for.
And who are the lobbyists that are against that then?
What do you think? Guys from the insurance companies and the drug companies.
Okay, and then what politicians work with those? Why don't we?
And you have to remember, too, what the propaganda is going to be on the other side. So when you're preparing your statements in a normal conversation with someone or in a political messaging campaign, you need to instill a form of understanding and support for your policy that'll be able to withstand the opposition's attacks.
Know what politicians are cheating us so that we don't have them in anymore.
And that's a good point here when Theo says politicians are cheating us. I remember when Theo said that Trump and Bernie should be on the same ticket, which is ridiculous to someone who pays attention to politics. But for someone who's from a background who's not very into politics, they might be from a more humble beginnings. Maybe they struggled a little bit growing up. Both Bernie and Trump can take this anger of why are the elites doing this to us? But the two ways you can take that is, populism on the right side, which is fascism, and Donald Trump, or populism on the other side, which is more worker power, more healthcare for everyone. Taking, why are the elites doing this and redistributing that and making sure everyone's taken care of, that people have a say in it, not turning into a civil war and a race war like Donald Trump wants to do. So we need to make sure our messaging is good. So when someone says to us, how about these elites? We want them to come on the good side about forming community and a good neighborhood versus talking about George Soros and some weird conspiracy theories.
Why don't we know what politicians are cheating us so that we don't have them in anymore?
All right. You're a smart guy. You tell me, how often have you heard a discussion in this country about how broken the healthcare system is and comparing it to other countries?
A lot.
All right. You've heard a lot about this?
Well, I think I hear a lot about, I look into it a lot.
All right, you look into it. But how many people even know that we are the only major country on earth not to guarantee healthcare to all people? So when people say, oh, Bernie Sanders is a radical idea, he thinks everybody should have healthcare. Really? That exists in Canada, it's in France, in England, in Denmark, in Sweden, in every bloody country on earth, virtually, rich country. So it's not a radical.
Even Mars, I heard they have healthcare there now.
I wouldn't be surprised.
Now, some people would say that the argument against that would be that then there's less personal responsibility to take care of yourself, right? But do you
really?
But that's
Bernie's
that
so
would be,
sharp. He's been around so long. He's so sharp. He's done with it. He's talking so nonchalantly. This is effortless for him. But people do bring up this argument. What about the personal responsibility aspect? In general, a negative environment where you're punishing people and you're saying we should keep a worse healthcare system for everyone because you want to have this arbitrary method of holding people accountable for taking care of their own bodies. That's just, it's not true psychologically. It's dumb systemically. And like in general, if you think about what makes someone want to take care of their own body, it's other healthy reinforcements. It's good community. It's knowing you have neighbors who care about you. Someone else's love and care for you, and someone else caring about your well-being, and having a country, a society, a world that cares about supporting other humans. That'll do more to get someone out, you know, keeping themselves healthy, eating better, exercising, seeking out medical help. That'll do more than a million years of punitive punishments. And, you know, it's just dumb if you're going to say we shouldn't do a better system because I have this idea in my head that we need to punish people. Punishing does not work. We need some more positive.
being in other countries anyway, right? That would be
positivity.
What is
anywhere.
if God forbid you or I came down with a serious illness tomorrow, am I going to blame you for coming down with cancer? I mean, is that a personal responsibility?
That's a good point. Yeah, probably not. That might just be kind of a ghost of an.
Now, to be fair, someone's probably going to bring up something other than cancer. So the main one someone's going to bring up in America is obesity, which is a public health crisis. But even that has to do with overhauling government regulations largely, and healthcare and mental health care and a million other things. But still, the same topic, the same concept applies, I mean.
An argument.
And but to pick up on that point, what should
Let's stop blaming people. Let's stop hating people, you know? Let's try being nice.
But to pick up on that point, what should one of the priorities of a good healthcare system be? It should be to try to keep people healthy. So it should encourage people to have good diet, to do exercise, to stay away from, addictive stuff, right?
Mm-hmm.
Do we do a particularly good job on that? Not so much. Because where do the insurance companies make their money? Hey, if you're really sick, pretty good.
Yeah.
We keep
profit
you healthy.
from addiction.
Not so much.
Are they one of the largest lobbyist groups?
Yep.
Wow.
Very, very. They're huge. I mean, and we started this discussion. You talk about, privatized communism, whatever the expression you used, is I believe that, Medicare is the health insurance program for the elderly.
Mm-hmm.
Medicaid is for lower income people. I think we should combine all these and guarantee health care to all people. But your point is that in the private sector, we are moving to a monopoly. And it's true. People like United Health, unbelievable. United Health, to the best of my knowledge, has under contract or hires 10% of the doctors in America. Wow. Got that? One insurance company. 10% of the doctors.
And so how would you?
I remember during the 2020 primaries, or was it 2016? It might have been either one. But one attack to Medicare for all or healthcare for all was if you did not have as big of a private healthcare industry, because you still, in like the Canadian system, if you're super rich in Canada, you can get other care. You can be a doctor who accepts private payments and whatever. But one of the big attacks was if we don't have a private sector being this big and being this bloated, then we're gonna lose a lot of jobs in the office workers, essentially. I forget what the claims experts, I guess. So the big complaint was if we have Medicare for all, we're gonna lose jobs in the sector where their job is to find out how they can basically deny people health care. That's their job. Let's look through your plan. I work for the health insurance company. When you call me, I'm going to try to make sure that our insurance doesn't cover you. And they were using losing those jobs as a reason to not do Medicare for all. That's like saying we should set more fires because it'll help us hire more firefighters.
You even start to undo something like that? Like, what's a realistic path to reform, I guess?
Thanks. Great question. Because I wrote the bill, I know the answer.
Mm-hmm.
Okay.
Okay.
All right. Right now,
that's a classic.
You have Medicare, which is a very popular program. It's life-saving to many elderly people. That was developed in the 1960s by President Lyndon Johnson. Okay, very popular program. You got Medicaid for the lower-income people, also a popular program. What I would do is, over a 4-year period, take Medicare. First thing you do is expand Medicare, because Medicare does not now cover dental, hearing, or vision. A lot of people can't afford to go to a dentist. Got me?
Yeah.
Okay, you expand it. And then you say, right now, to be eligible for Medicare, you got to be 65 years of age.
Okay.
First year, lower it to 55. So you're 57, congratulations. You don't have to worry about whether you have insurance on your job. You want to hear something else crazy about the private insurance system. You work for a big corporation, okay? Mm-hmm. They give you good health insurance. He works for McDonald's. virtually nothing. All right? That's pretty crazy. Where you work determines the kind of health care you get. Anyhow, so we go from 65 down to 55, 55 next year down to 45, 45 to 35, 40 year you cover everybody. Gradual.
And that's a great way to explain it too. It's really good because everyone has the issues with, will there be capacity? Will we handle the amount of people seeking care? But one reason we don't have that capacity is because the current system was molded by the current system or whatever. So the current issues with capacity are largely a result of a lot of red tape that we do have in America, blah, 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 whatever.
Absorption. So you have a Medicare system that covers all people. You no longer have to pay any more deductibles or co-payments, no more premiums. You get your health care because you're an American citizen. Will your taxes go up? They may. Will it be less than what you pay right now in private insurance? Yes, it will be. It's a good deal.
I think it's worth noting there's a lot of different forms when it comes to universal health care. So there is a single payer model, which is what Medicare for All is modeled after, the Canadian approach, where there are only the government that pays. That's why it's called single payer. So only the government pays in Canada. Like I said, you can go to private providers and pay out of pocket. But we do have systems like Australia, which is mixed. So everyone's guaranteed to go to at least a public hospital. But if you're rich, you can go to a private hospital that's probably a little bit fancier. We have the UK, which is fully nationalized and owned by the government. I should add that the single payer still has private doctors, but those private doctors are paid by the government. And then if you want to be a private doctor that gets paid in cash, you can do that as well. Then there's a bunch of mixed systems through Germany and France. So not every version of this requires fully dismantling the private sector. You can have what we currently have, but like Bernie's saying, we would keep on expanding Medicare to cover more and more people every year and let the system adjust as that goes. There's a lot of different ways to do it.
Deal.
Can we afford that as a country, you think?
Sure.
Yeah?
We are now spending over $4 trillion on healthcare. We spend double. Here's another point to be made. We spend twice as much per person on healthcare as any other country because it's designed to make money for the insurance companies and the drug companies.
Wait, so explain it to me. So we spend twice as much on healthcare.
We are spending right now, Theo.
As any other country?
Yes.
Per person?
Yes.
But the money isn't going towards them getting, so we'd almost save the money just by.
You got it. All right. Here, example.
Is that
right?
true?
Yes, it's true. Check it out. It is true. Chairman of the Bloody Committee. Yes, it is true. All right.
Bloody, literally, people are fucking bleeding out, dude. Yeah.
All right. If I buy a car tomorrow for $80,000, you buy a car for $40,000. What is the presumption? Should my car be a better car than yours?
Yes.
Okay. I'm spending twice as much. All right. But I got a much better car than you have. All right. We are spending per person, over $13,000. All right. Spending $13,000 on you, $13,000 on me, $13,000 on a 5-year-old, $13,000 on a 90-year-old. All right. $13,000 per person, over $4 trillion nationally. Canadians are spending about half of that per person.
And they're taking care of everybody.
Yes. And the British are spending less than that. Other countries a little bit less.
But does that affect us?
And always add, a lot of the money we spend on healthcare is going to give jobs and pay people whose job it is to deny us healthcare. There's even more bureaucracy on top of that. And then a big slice of what we pay is reserved for corporate profits as well. So if we can cut those two things out.
So with the population number that we have?
Doesn't matter. I mean, per person.
Got it. Okay.
I'm not talking about in gross, but
right.
per person.
How do you stop hospitals from overcharging?
That's part of it's a corrupt system.
If they know that the government's going to pick up the tab.
Good. Very good question. And the answer is what they do. And I mean, it's not like we're inventing something. Other countries do it. What they say to hospitals is, look, you're not going to be charging Theo when he's in the hospital. You're not going to be charging him a nickel. But we know, roughly speaking, in a year what you are going to be. You need a certain number of doctors and radiologists and nurses and all that stuff. Here is your budget. It's like a police department. Here's your budget in a year. You need more, maybe we'll come up with more. You get what we call a global budget.
It's like the Dodgers or something.
But you got a global budget.
Right, you got a budget.
And you take care of all the needs. It's not per person. You get it. And what you do there, we spend as a nation, one of the other insanities of this healthcare system, we spend hundreds of billions of dollars on billing. You know what I mean by that?
Medical billing, yeah.
All right. So on the insurance companies, first of all, you got to fill out forms. I hire people who are not doctors or nurses, right? They just book.
Oh, yeah.
Oh, and also our private system right now where doctors need to find a very specific code so your insurance company will cover something. I think I got a bill for a mental health related, like psychological evaluation or whatever. It was a scam, mainly for ADHD stuff. and the bill was $12,000, and I thought I was gonna have medical debt, but apparently I was able to get a different code put in, and then the insurance company covered it. So a lot of a doctor's day is memorizing codes for different insurance companies to try and get their patients care. So doctors waste tons of time and resources in order to work with private companies that they wouldn't have to waste if there was a solid public option. It would make it a lot easier. Single payer, any mixed system, anything but the American model, really.
Yeah.
All right, you got bill collectors. You go to a hospital, go down to the basement, got 100, well, depending on the size of the hospital, dozens and dozens of people. They don't see a patient. They're just filling out forms.
Yeah, half the Philippines is people just doing medical billing over the phone, you know?
Well, there are countries where you show your card and that's the end of the discussion. But we waste hundreds of billions of dollars just on billing people. Now, there's another issue I want to discuss. Life expectancy. What do we know about life expectancy?
We're getting pretty long in the tooth.
Nope.
We're not living long.
Nope. Compared to whom?
Compared to probably Vietnam.
Yeah, I'm sure, maybe. All right, but
Bernie's talking through this like a seasoned teacher or a college professor, and he's letting Theo engage. He's giving room for Theo to provide Bernie with the information Bernie needs to know where Theo's coming from. So Bernie can then adjust his conversation style to reach Theo where he's at.
all right. We are the richest country.
For all you language experts, I know you're a genius already. You activist organizers, I know you're a genius. You can go watch the regular version if you don't like me interrupting. But we need to hyper focus on this because none of y'all know how to do this. I see you on Twitter. I see you in real life. I see you in college campuses. You don't know how to do this good. You got to take some notes.
On Earth.
I promise.
Do we live longer lives than other people?
No, we don't.
We do not. In fact, we're pretty far down the list. Why is that?
Well, I mean, I think it could be that we're not taking as good care of ourselves.
Okay.
And I think it could be that, that we don't have as good a health care.
That's right. All right. I think that's two out of three. All right. Now, here, there are two facts. Japan, other countries will live 4 or 5 years, 6 years longer than we do. That's a lot. You know what I mean?
Yeah.
So they'll live, I forgot what it is.
Like 8% or something.
Yeah, right. It's a lot. But here's another fact that is really unbelievable. It's not just that we live shorter lives despite spending so much on healthcare. The gap between the 1% and the working class is 10 years. If you're rich, you'll live as long as people in other countries. You have a long life, in the 80s or whatever it is. If you're working class, you're going to live 10 years younger. How does that happen, do you think?
Wow. Because just stress, burnout.
All right. I'm going to sign you up there. You got it.
Look, I think I like a lot of the things that you think about.
All right, let's deal with the issue of stress.
Okay.
Yes, you're right. It is twofold, it seems to me. Number one is if you're rich, you go to any doctor you want when you want it, get paid for all the drugs you need, right?
Yeah.
All right, that's a real advantage. But above and beyond that, working class people live under enormous stress, right? And that takes a toll on you. It takes a toll on you physically and mentally. And that is, we have parts of this country where life expectancy is actually in decline. Got it? People are living shorter lives.
Because of the stress.
Because of the stress. And with that stress and the hopelessness, they turn to drugs, they turn to alcohol, they turn to suicide.
Yeah.
All right.
I was going to say that as a patriot, you should care about the life expectancy going down in your country as a way to contrast with the right wing in America. But I know that if I do say that to someone, they are going to say that it's actually being caused by immigration and immigrants murdering. And it's going to be caused by immigrants murdering Americans or whatever. So I don't know if I really can do that. That conversation might not work. I don't know.
That's
the way the political landscape is right now. I don't know what conversations we can have because everything is a conspiracy theory.
People are
apparently
living shorter lives.
Because of the stress.
Because of the stress. And with that stress and the hopelessness, they turn to drugs, they turn to alcohol, they turn to suicide.
Yeah.
All right. Bad stuff.
A lot of this ideology, too, is centered around not assuming malice in another human being. So when you see someone struggling, when you see someone suicidal, depressed, anxious, unable to work, not taking care of their body, like we talked about before, don't assume malice. Don't assume that someone's in a bad mood because they hate you, because they're an evil person. They're doing this because they're worthless or they don't want to work hard. maybe just go into situations with more understanding. We need less malice and hate in America. We need less punitive punishments in America. We need more understanding. And those who are the angriest and whatever in America right now that want to cause violence and do civil war and they think the world's falling apart, those people need understanding more than anyone. And that's probably why they don't show others understanding, because they don't give it and they never saw the world in that way. So we gotta bring back neighborliness, neighborhoodness, whatever Tim Walz says. I like that guy.
Oh yeah, I think those are things that yeah, they don't even take those factors into consideration when they're making all of these, you know, you call to get your medical bill, it's a nightmare. It's like you almost want to. This is crazy. There's been times when I've been like, I would rather take my own life than sit here and make another fucking call. And I'm not even sick, you know? I'm just somebody trying to get to the bottom of the
All right, and why does that happen?
Because it's loopholes. They don't want you to get paid.
You got it. Not that hard. Look, you pay me money through insurance, right? So you're sick. I'm supposed to, pay your bills, right? If I drive you crazy, you're going to say, screw it. Hell with it. I'll pay the goddamn thing.
Bernie's so good.
Yeah.
Good. I'm the insurance company's like, hey, right on, man. That's exactly what I wanted.
Today, we're here to...
Oh, yes. I'm not going to steal any more content, but let's start a petition for progressives to stop monologuing and instead take this conversation style, because this is fantastic. Anyways, if you watched to this point, you're probably here for the Theo Bernie conversation, but please consider liking, dropping a comment, and subscribing to my channel. We'll be doing a lot of coverage and commentary for this election, talking about progressive issues and all of that kind of stuff. Yeah.